Hey everybody, and welcome back to the channel. Today we're going to be talking about 10 superfoods that you can use to help alleviate pain, to reduce arthritic pain, and to reduce neuropathic pain. And in here in the clinic, we help people overcome neuropathy, whether it's due to diabetes, it could be due to chemoradiation, spinal surgeries, knee surgeries, any type of lower extremity surgeries. And then also it can be due to autoimmune issues, it could be due to alcohol-induced or smoking-induced. These are the foods that I have found that have the greatest impact when we're talking about reversing any type of pain, that have the greatest benefits, from antioxidants to omega-3 fatty acids to alkaloids, so that they can help alkalize the body if the body's too acidic. And I want to cover these today and talk to you about how you can add these into your daily routine to help you overcome any type of these pain syndromes that are occurring. Now, your gut, just to tell you, is one of the main components that you need to correct in order to address any type of arthritic pain. Leaky gut has a high correlation between any type of knee arthritis, hip, pretty much anywhere in your body that you have arthritis. That has a huge component into it, as well as your body being too acidic, because that will strip the bones of calcium in order to buffer the blood, and then it gets deposited in these joint areas. I have a video about that, so go back and watch my video that talks about how these arthritic changes occur and how, when you have more acidity in your blood, that affects the calcium in your bones, and it affects the arthritic changes that most people are experiencing today. But today, I just wanted to give you some 10 foods that you can start implementing already into your diet that can start having an immediate effect. And you need to do this for about 30 days in order to see any type of change, along with cutting out any type of simple sugars, because that is the main component when it comes to this. And always talk to your doctor or healthcare provider who knows more about diet and nutrition in order to get the best benefits. But the first one today is turmeric. Now, this is something that is found in like yellow mustard. You can also find it in certain Indian dishes, curries. So if you like Thai food, then typically your yellow or red or orange curries have a lot of turmeric in it, and that's what gives it that yellow coloring. That's why yellow mustard has that yellow color. So if you like yellow mustard, then you can do that and help with the arthritic pain, because this has a lot of antioxidants in it that will help with reducing the amount of inflammation in your body. You can also make a golden milk tea with turmeric, and a lot of people use that, like a turmeric with some almond milk. There are plenty of recipes. Comment below if you want me to send you over a recipe for that, and I can definitely do that. But that's something that you can do. You can drink it in the morning, or you can drink it midday, or even at the end of night, because it doesn't have a lot of caffeine and it won't keep you up throughout the night. But you can use that as a day to help combat any of that inflammation that you accumulated throughout the day. So that is the first one. That's the top one. There are a lot of supplements that have turmeric in it as well, because it's such a powerful antioxidant that if you supplement it, typically what you want to do is around 500 to 1500 milligrams twice a day is what I recommend for most of my patients. But like I said, always contact your healthcare provider. But that's what I recommend in a supplement form. Ginger is another one. Ginger, people eat it with sushi. There are a lot of ginger teas. You can grate it and put it on any of your dishes that you make, like with rice or anything like that. But ginger is the same thing. It has a lot of antioxidant properties that help combat the inflammation that you accumulate throughout the day. And it can also help alkalize the blood, so that you don't get that calcium pulling into the bloodstream that causes those arthritic changes. So ginger is a great one as well. Blueberries. So these top 3 are mainly antioxidant properties. Blueberries, same thing. Any type of the berries, the reason that I suggest that you use those is you can add those with like a yogurt, or you can do them just like a fruit mix. Now, you have to be very careful if you have diabetes because of the sugar content of these. But typically, as long as you're not juicing them, then the fiber that is found in the berries will help control those blood sugar levels. But it is something that you may want to take your glucometer and check and make sure that those blueberries aren't spiking your blood sugar and causing more damage that we see with like the neuropathic type pains. Salmon, this works in a little bit different realm. This has your omega-3s in it. Now, there are two types of omega-3s. There is the EPA and there's DHA. EPA, I tell people to think about Environmental Protection Agency. So it helps clean out systemic inflammation throughout the body. Whereas DHA is what your nerves and your brain is made of. And so by supplying DHA, you can help rebuild those nerves and help calm them down. And any damage that occurs to them due to multiple factors that I mentioned before earlier, this can help repair the damage that was done. So that one's a great one as well. Now, with this, when I was in school, and part of the reason why I believe I was able to get through it so well is that I superdosed omega-3s fish oil and used it in order to keep inflammation in my brain down because you're studying all the time. So what I would do is I would do 500 milligrams, and it's actually 1,500 milligrams, and I would do that 3 times a day. Obviously, if you have any type of heart conditions, you need to talk to your cardiologist to make sure that you can do that, or your other primary care, make sure that you don't have any medications that can be counterintuitive when you're taking omega-3s, because I do have some patients that we have to be kind of a little bit concerned about supplementing omega-3s. But I use this for a lot of my brain injury patients, traumatic brain injuries or concussions. This works great. Now, spinach, this is something that you have to be very careful about, especially if you have chronic kidney disease because of the oxalates. You don't necessarily want to do a lot of spinach. However, if you're fairly healthy and you have like a good metabolism, you don't have excessive proteins in your urine or anything like that, you can supplement spinach into your diet and use that because it's going to provide, again, like an antioxidant benefit, and it's going to help regulate some of the inflammation in your body. If you have an oxalate sensitivity, so if you notice you get brain fog after eating spinach or eating any type of almonds, you may have that oxalate issue, and that can sometimes damage the kidneys, so be very careful about that. Now, avocado, just like the salmon, is an omega-3 fatty acid powerhouse. So using this like in the morning, if you want to, pair it with eggs or something like that, is always usually a good combination, or any type of meat in the morning. You can use that because it's going to, the fats I like doing more so in the morning because I do my workouts in the afternoon. So by doing my fats in the morning, I have more of a long-term sustainable energy. And then in the afternoons, I'll do more of, more my complex carbs, because that way I have all the glycogen ready in my muscles and I can burn that off immediately. Walnuts are another omega-3. So if you like walnuts, I would stay away from peanuts. Walnuts are going to have your highest concentration of omega-3 fatty acids, and they're going to help reduce that inflammation the most. And these are very good. These have a high ratio of DHA, which is good for brain health. So, and they look like a little brain. So in nature, I know that there's that theory that if the food looks like a certain organ, then it will help it. In this case, it's very true that walnuts will help with that cognitive ability and the brain because of the omega-3s in it. Green tea is another powerful antioxidant. So you can see how if we get the right ratio of antioxidants decreasing the free radicals in the body and the fatty acids to rebuild that nerve health, then we can really take a huge step towards getting rid or reducing that pain that we have every day. So green tea is something you can enjoy it more so in the morning because of the caffeine, or the midday to help kind of boost up your energy. So you can use that as a replacement for coffee, is what I usually tell people. I don't like people who have to use a lot of caffeine throughout the day or use coffee chronically, because that can indicate that you're wearing out the caffeine receptors in your body. Dark chocolate is another antioxidant one. So now this one needs to be over, so it needs to be over 70% dark chocolate. So if you're doing anything less than 70%, then a lot of times you're getting too much sugar with that, and that can be counterintuitive, especially with your milk chocolates. So 70% dark chocolate is kind of the lowest threshold in order for you to get the right ratio of antioxidants and not to take a step backwards. And then cherries, like a tart cherry juice, is really good for inflammation, for helping with joint pain especially, also helping with adrenal function. So that is a very key one. Same thing, you want to make sure that you're not doing too much juice. It's better if you can eat it because of the fiber content if you have blood sugar issues. But typically you can find like a really good tart cherry juice that doesn't have any added sugars into it. And that can be something that you can use to help with any type of joint pain as well. So there you have it. Try adding, so I want to give you an action step. Try adding, maybe 1 or 2 of these foods into your diet a week. And do that for the next, 6 weeks or so, and you should have a very good consistent diet full of antioxidants plus omega-3s that can help reduce any of that arthritic pain, that neuropathic pain that you're experiencing. Obviously, there are other things that you can do, but start here because we want to try to get the lowest hanging fruit. And when it comes to your health, the diet is always a good place to start. You can go back and watch some of my other videos where we talk about the Mediterranean diet and how that is the best diet for longevity purposes. And then you can also do fasting and keto for other certain issues, but try adding this in here. If you have any questions, just comment below. If you found this video helpful, I'd really appreciate it if you like it, share it with your friends and family, and even subscribe to my channel for more videos like this. All right, everybody. It was great seeing you all today, and let me know if there's anything else that you would like to learn about, and I can make more videos about. All right, have a great day. Bye.